Hi, my name is Nadolsky. I'm the founder and CEO of MediBookr. MediBookr is an online marketplace for medical imaging, as Jeff mentioned earlier, such as MRI, CT scans. So what is the problem we're trying to solve? If you are someone you know trying to do an MRI, you might have noticed the big price variance from a few hundred to several $1,000s. What's more, there's really no easy way to capture price, quality, availability of the centers quickly other than calling them one by one, kind of like the travel industry 15 years ago. As our health insurance plans move toward high deductible, high copays, patients have to shop around. But there's really no good solution out there to help them. On the other side, for imaging centers, they're having a hard time to attract savvy shoppers as well to fill up their expensive facilities. When their expensive appointments go unfilled, it is very costly to them. So you wonder how big the problem is. Americans spent $100 billion last year on over 200 million scans or images. So we focus on the outpatient imaging market, which is about $19 billion, which struggles the most. We focus on the users, patients with high deductibles or uninsured patients or patients with self-funded employers. To solve the problem for both patients and providers, we created MediBookr. So as I said earlier, MediBookr is really the online marketplace where patients can quickly search for transparent information and then evaluate the quotes on price, quality, availability of the centers, and quickly book with whatever is best for them. For imaging centers, they can list their services and their prices, offer quotes and book with patients, improve their utilization, operation, efficiency with analytics. So imaging centers onboarded us see decreasing patient acquisition cost and increased profit margins and utilization level. So our competitive advantage, as you can see here, our solution is transparent. The prices can be dynamic to the providers and patients, and we also offer analytics to help providers to improve their utilization operation, as I mentioned earlier. So we are free to patients. We charge the imaging centers and payers a monthly fee, and also whoever advertises on our site, we charge a small advertising fee. We are currently launched in DFW with early revenue. Currently, we have 12 imaging centers paying us for our service. We have 47 in the pipeline getting on board in the coming few weeks. The first 100 users, patient users who have used us, told us they love our solution, and so do their physicians. We're also currently in discussions with a very large self-funded company to bring our solution to their 50,000 employees. So our plan is to grow in DFW first, and then expand to Houston next month, and the next few nearby cities in the coming 6 months. In due time, we can bring our services to other cities in the US. We also plan to expand to other verticals in the coming few months, such as labs, surgeries, clinics, and prescription drugs. So how do we get customers? We onboard imaging centers by sending them patients, by leveraging our networks with them. We attract patients through our SEO, SMO strategies, and also direct referrals from physicians, payers, and partnerships. We're a full team with expertise from both healthcare and digital technology. Most of us have built successful ventures. We projected to reach revenue $380,000 by the end of first year, break even by year 2, and reach $81 million in revenue by the end of year 5 with EBITDA 30%. So funding status, I invested $100,000 last spring to start building the platform. We received $230,000 last fall from 3 angel investors. We're currently raising $375,000 to accelerate our growth in DFW and to open other markets. So our mission is to improve healthcare quality and efficiency via our digital technology and transparency. It takes a village. So if you like what we're doing and you would like to be part of it, please reach me afterwards. Together, I believe we can take our solution to many other patients in many other places. Thank you.